Stop. If you are over 50 and your skin is itching, don't scroll any further. What I am about to tell you will save your life. In my medical practice, I've seen hundreds of patients who ignored what seemed like a simple itch. Do you know what happened in the end? Stage 4 cancer. Today, I'm gonna tell you a truth most doctors never tell you because they don't have the time, or worse, because they don't care. But I refuse to stay silent while people die simply because they didn't know. That's why listen very carefully. You are about to learn the 7 warning signs that should never be ignored. 2 years ago, a 46 years old woman, Marianne, came to me. She complained of itching in her palms. For 6 months, she used creams thinking it was a dryness or aging. I examined her hands and I froze. I sent her for tests immediately. 1 week later, stage 3 pancreatic cancer. Do you know what she said? If I had known, I would have come earlier. That's why I need you to listen to every word. In older adults, itchy skin is not just an itch, it's a distress signal from your body. If you are over 50, the statistics are alarming. According to the National Cancer Institute, itching was the first symptom in 30% of cancer patients long before pain, fatigue, or weight loss. Yet, most patients are sent home without nothing, just only with a cramp. 1 year later, many are gone. Why? Because tumors release toxins. These toxins enter the bloodstream. The liver tries to cope. When it can't, the body uses the skin as an exit. And sometimes it is not even the skin, it is the nervous system screaming for help. The most dangerous mechanism of all is called paraneoplastic syndrome, when the immune system attacks the skin while trying to fight the tumor. Now, listen carefully. If you have 2 or more of the following signs, see a doctor tomorrow. Not next month, not next week, just tomorrow. Before I list those 7 points, please don't forget to subscribe to my page. 1. Itching of the palms and soles, especially if it worsens at night. This is a classic sign of liver or bile duct disorders and is often associated with pancreatic, liver, or gallbladder cancer. The palms and soles are rich in nerve endings. When bile acids accumulate in the blood due to a tumor, they stimulate these nerves first. Nighttime worsening of the itching is a serious red flag. Second, generalized itching all over the body without any skin rash. This usually indicates a systemic problem, not a skin condition. It's commonly seen in the lymphoma, leukemia, or metastatic internal organ cancers. The problem is not in the skin, it's in the blood. Cancer cells release histamine and cytokines, which trigger itching directly through the nervous system. Third, itching accompanied by jaundice. This is extremely important. Even mild yellowing of the skin or the whites of the eyes should never be ignored. A tumor might compress the bile ducts, causing bile to leak into the bloodstream, leading to jaundice and severe itching. 4. Anal or genital itching in the older adults. This is not something to be embarrassed about. Colon, cervical, vulvar, or prostate cancer may present with this symptom. Warning signs include blood in the stool, thinning of stools, frequent bowel movements, and a sensation of incomplete evacuation. 5. Itching accompanied by localized hair loss and scalp itching. This may indicate a rare but aggressive condition called cutaneous lymphoma. It doesn't respond to topical creams and requires a biopsy for diagnosis. 6. Itching combined with unexplained weight loss. This is a serious warning sign. Unintentional loss of 5 kilograms or more within 3 months without dieting requires urgent medical evaluation. 7th, itching accompanied by enlarged, hard, painless lymph nodes. This may be a sign of lymphoma or metastatic cancer. The neck, armpits, and groin should always be carefully examined. Result: not every itch means cancer. Diabetes, thyroid disorders, kidney disease, and allergy can also cause itching. However, cancer must always be ruled out. Dangerous itching lasts longer than 2 weeks, doesn't respond to treatment, progressively worsens, and causes sleep disturbance. If itching is accompanied by weight loss, fever, night sweats, or fatigue, it must never be ignored. Early diagnosis save lives. While 90% of stage 1 cancers are treatable, this rate drops dramatically in advanced stage. Don't panic, but don't ignore it. If your body is sending you a signal, listen to it. Your life is in your hands. Take care. See you later.